giving us the opening prayer. We have our Home Secretary giving us the opening prayer.
Shall we pray? Father in heaven, we are grateful for a moment like this. We are grateful for all that you have done for us. Father, we present the presenter into your hands, that you give them the wisdom and knowledge, so that what he's going to teach us will be to the greater glory of your name. This and many other blessings we ask through Christ our Lord. Amen.
Thank you very much, Honorary Secretary. It's been a wonderful day today, and we are hoping that by the end of this CPD, we will go further in enhancing our health, because it's very, very important. As surveyors, if you are sick or you are not healthy, what are you working for? You see, something is very peculiar about when it comes to surveyors from SMD. They are put in the field after you have finished your service, where you are given license to work. So without health, in spite of the license given to you, you cannot do anything with it. So your health is very, very important for us. Now, over the past, this is our fourth CPD for our session. We've had the first one on the amendment of GhIS diploma numbers. Then we had the second one on membership in good standing, and then the rights and responsibilities. That same day, we had two sessions. Then the second one was understanding the welfare concept of GhIS. We had profound speakers who took us through, and the third one was just something else. We were able to unlock the economic potential of the 24-hour economy. We will be having another session, not yet, the date not yet in, but we're doing another part 2 of it. So that's what we've ended for the 3 sessions, and we are having the 4th one, and this one is on healthy surveyor and the best practice. If you are not healthy, what are you practicing for? Where is it taking us to? We need to know how healthy we can be, and to be able to ensure that we are healthy to the end. We are not healthy to a stage whereby you cannot go again. Although in life you cannot live forever, but still you should be strong in everything that you do as a surveyor. And without wasting much time, I want to introduce
as a psychologist. They started laughing, and then one guy started pointing to another guy that, oh, we were bodam. And I said, oh, when we talk about psychology, it's not about them. Since 2008 that I started practicing, I've never encountered a mentally ill patient before. I need to talk to people like you and I. Okay, people like you. I remember when I went for my interview at KNUST, I was asked to differentiate between who a psychiatrist is and who a clinical psychologist is. So you see the difference. So one of the questions that I was asked at KNUST interview was that, what is the difference between a psychiatrist and a clinical psychologist? So psychiatrists are medical doctors who take care of mentally ill patients. They are psychiatrists. But for clinical psychology, we are psychologists, and we need people like you to interact with. People whose thoughts are coherent. I need to understand you. So I'll be able to go into your mind, and then we'll be able to know what is affecting your emotions and your behavior. When Daddy was speaking, if I was talking about health, I saw him doing this, so that I have health. So it means that he's really interpreting health as physical. And that is one of the things that we are going to learn today. We are going to look about health from other perspectives. And that is why we call, currently when we are talking about health, we call it holistic health. Holistic. Holistic means that it is not only physical, but there are other perspectives of health that we need to look at. We need to look at it. So I was asked to look at healthy surveyor best practice. So my outline is what I've put on the I'll put there. So we are going to look at what's the definition for health? What is psychological health? And that is my emphasis. I'm not going to talk about physical health, but I'm going to emphasize on psychological health. And then who is a healthy surveyor? That will answer the first part of the question. And then we come to the second part of the question, when we talk about better practice, the relationship between psychological health and then the work of surveyors, the effect that it has on their performance, and then some practical interventions, and then my concluding remarks. There is also a difference between what clinical psychologists do and what counseling psychologists do. For clinical psychologists, we do assessment, we do diagnosis, and then we do interventions for people who have psychological issues. So medical doctors will do assessment, diagnosis, and interventions for medical issues. Clinical psychologists will do assessments, diagnosis, and interventions for psychological issues. So, practical example. I remember when I was at KNUST, a pharmacy student. She interacted with the dad on a Saturday. And the Monday, the dad promised her that she would come and pick her to the house. They were living in Cape Coast. And the father was working with one of the universities in Cape Coast. So, after the gentleman, the dad had spoken to the lady, the dad sat in the car and was going to visit the second born. The lady was the first one, was going to visit the second born at Adisadel College. Now, those who have applied that road before, when you are getting to Mankesim, there are these two metals. It's like it's like a bridge on a river. There are 2 footbridges. Immediately after that, you hit Mankesim, the roundabout. So, I don't know what happened, but the gentleman used his car to hit one of the metals. A gentleman who was spoken to the daughter that I'll come and pick you on Monday, on a Saturday, and was going to visit the second born, hit that metal, and the car somersaulted, and he died. Now, the whole thing started popping on social media. So Monday, we had to break the news to this lady, and it was very traumatic. Breaking bad news is also a profession on its own. Breaking bad news to somebody is a profession. Because if you don't do that, you remember when Lumba died, one lady in Germany who had the news also died. She has been buried and Lumba hasn't been buried. So breaking of bad news is very, very important. And there is a way we go about it. And in fact, it was one of the toughest days for me. One of the things that we say is that if you are a psychologist and there's a client in front of you and you are crying, the client is crying and you are also crying, then who will give intervention to who? So in fact, we call it emotional competence. I had to hold my emotions. And I remember when I told this lady that your dad, whom you communicated with on Saturday, is gone, the lady seriously cried. And this affected the performance in her exams. So this is a psychological issue. This is psychological. Okay? So when you go through a traumatic situation, it affects your thinking, it affects your emotions, it affects your behavior. That's psychological. Now, what the psychiatrists look at is, for example, if somebody is taking substances. Now, the latest one is, I think, red, right? Yes, red. Somebody takes red and the person loses consciousness. There's a guy I found in my area who has been standing at one place for days. A guy in my area. He has been standing at one place for days. I passed there in the morning, he's standing there. I passed there in the evening, he's standing there. He hasn't bathed. The dress that he's wearing is tattered, and so on. This is a psychiatric issue. When you ask him a question, he doesn't talk. He's just standing there like this. So this is a psychiatric issue. So that's the difference between psychiatrist and psychologist. So there are issues that will take you to see the psychologist, and there are issues that will take you to see the psychiatrist. But in my facility at St. Michael's Hospital, we do holistic health there. When you go and see a medical doctor and the issue is psychological, they refer you to me. And if it is psychiatric, they refer you to the psychiatrist. And everything goes on perfectly there. Yeah, so let's get this clarification. Now, when we talk about health, there have been so many definitions by World Health Organization. Even World Health Organization has given so many definitions in terms of years. But I love this definition. It's that health is a state of complete physical, mental, and the mental, I'm not talking about madness, mental. So I've broken the mental into three: psychological, emotional, and social. Okay? So psychological, we are talking about psycho, in your mind. And there is a lot of research that shows that the mind is connected to the body. Your mind is connected to the body. So when I was growing up, there was this adage. It says, a sound mind in a sound body. So because they are connected, if your mind is not sound, it affects your body. There have been cases where we have seen a gentleman that I saw still at KNUST who was so stressed that he became paralyzed. So stress causing paralysis. The direct relationship is not there, but it is a psychological conditioning in the mind that has metamorphosized into a medical condition. There are conditions like that. So you see the person as having rashes. You see the person as having hypertension. You see the person as having diabetes, and so on and so forth. The person has taken a lot of medications and is not working. And some of the cases we have seen, the underlying condition is psychological, but is being treated medically. So there have been people who have what we call psychogenic headaches. So the headache which is there, the person will take a lot of painkillers, it will go down, it will reduce and bounce back. And the reason being that underlying that headache is a psychological condition. It's not a medical condition that is causing the headache. It's a psychological condition that is causing the headache. So we need to treat that headache psychologically for the headache to go off. So there are psychological conditions that metamorphosize into, we call them somatoform disorders. Soma. Soma just means body. So these are issues that the person is battling with in the mind, which is psychological, but they turn themselves into headaches, into hypertension, into diabetes, into rashes, and so on, and into ulcers, and so on and so forth. So when you see it on the first approach, you might think it is medical. So doctors will treat, but the condition will be there. I remember at St. Michael's one day, a lady visited me in the office. The lady had asthma. And the lady had been doing the pumps, the Ventolins, whatever. It's not going. So based on the discussion that the lady had with the medical doctor, it was a marital issue. So the doctor said, no, let me refer this lady to Mr. Yawson. So when we sat there and started talking, I realized that the marital issue that this lady is battling with has metamorphosized into an asthma. Yes. So now I had to do, that's why the fact that she was doing the pumps, the Ventolins, the pumps and all those things. We also did psychological interventions, and she's now okay. She's better. So there are always underlying factors for conditions, and when we are able to get the underlying factor, we are able to treat the condition. So when we talk about health, we are talking about four things. I'll add a fifth dimension. We are talking about physical health. Physical, very, very important. We are talking about mental health, which constitutes psychological, in your mind, emotional, your emotions, social, your relationship with people. If you are within a family and the family is dysfunctional means that the family is not functioning well. Either daddy fighting with mommy or mommy fighting with daddy. And there is one case that I'm dealing with. The two couples are fighting. They have separated, but they are living in the same house. Yes, they are living in the same house. Different room, but the same house. Okay? And the children have also deserted the house because there is conflict in the family. That's a dysfunctional family. It affects everybody in the family. Okay? And then, as far as we are Africans and Ghanaians, one of the health that we cannot do away with is spiritual health. We always forget that. Spiritual health. One case that I had, there is this friend of mine who is a top man at MTN. Every member of the family dies before 50 years. By 48 years, you will dream that you are carrying a coffin. And by 50 years, you go. So, the one in front of this friend of mine, the other brother, went off at 50. So, my friend hit 48 and dreamed that he was carrying a coffin. And that day, he watched me on TV3. So, he called me and he came to meet me. So, he said that this is the issue. So, we spoke, and I realized that the component is both spiritual and psychological. And I always tell people, I always joke with it that I'm not a prophet, okay? So issues that have to deal with spiritual, we refer to a spiritualist, in quotes, depending on your faith. So if you are a Muslim, we'll let you go to an imam to pray with you and so on and so forth. And then there are other parts of it. One client of mine too, one time 4 a.m. was going to wee-wee, and when he woke up, he saw one cockroach following another cockroach in front of his door. And the next day, he started having headaches. Immediately, the mind went on the cockroach. Oh, so it was the cockroaches I saw that has caused the headaches. But you cannot bear with me. If you don't sleep well, definitely you have some headaches. So Africans and Ghanaians, we spiritualize a lot of things. And that is why spiritual health is also very, very important. In fact, if any of these components, let's say physically, if you are not healthy, it affects the other parts. If you are not healthy physically, you can't pray well. So it affects spiritual. You also become sad, emotional. So it affects other parts of health. So we should always remember that health is physical, health is psychological, emotional, social, and health is also spiritual as far as we are Africans. So currently, this is the term that we use to represent holistic health. Holistic health. So when we have a patient in the hospital, this is the model we use to treat the patient. Bio. If I let me mention all, I don't want my brother to say that it is a big word. So the word is biopsychosocial into brackets S. Biopsychosocial into brackets S. So bio means that diseases that will take you to see the medical doctor or the psychiatrist. So medical conditions, bio. Anything biological. Okay? Psychosocial. So psychosocial means psychological and social. So anything that will take you to see the psychologist, the counselor, the sociologist, the social workers. You remember what happened just about a week ago at Ufanko? Remember? The gentleman who was caning the wife, you remember? Yes. So the lady got hurt, which is bio, a medical issue. The lady will be traumatic, psychosocial issue. It will definitely affect his relationship with God, a spiritual issue. So the S is spiritual. And this is the model for health right now. So if a client comes to me and tells me that my pressure is high and it runs through our family, then immediately I will know that it is a medical issue. I'll just write a referral for the person to see the medical doctor. However, if a client goes to the medical doctor and says that I have lost a daughter, I think last week a lady lost a daughter in Cape Coast. One lady, no, it wasn't in Cape Coast, at Dansoman, when the Dansoman market got bent. So she locked the daughter in the container and she was just going to buy something and come back. And then the fire hit the market and the daughter died. This is a traumatic issue. When you go to a medical doctor, he'll just refer you to me. So that is how we refer to each other. And so that the whole model becomes holistic. So this is holistic health. Okay. Now I'm going into what mental health means. Initially, I was looking at health in general, but now I'm looking at what's mental health. So, World Health Organization says that when we talk about mental health, it means that one, the individual who has good mental health should be able to realize his or her own potential. You should be able to realize the potential you have. If you are able to realize the potential you have, it means that you have good mental health. Two, you should be able to cope with the stresses of life. We go through a lot of stresses, a lot. And one lady client that I had on the Spintex Road, I don't know whether there is still traffic on the Spintex Road, but immediately she left home around 7 and she saw the traffic on the road, she starts experiencing anxiety. So the only intervention we give to her is that leave the house early. So when you leave the house around 5:36, you wouldn't meet the traffic. You'll be able to move without any traffic and the anxiety will subside. Okay. So normally what happens is that instead of us coping with our stresses, or instead of us controlling our stresses, we allow our stresses to control us. And that is why in certain religions like Christianity, I don't know about Islam, but in Christianity, when you are told that what is in you is greater than what is in the world, it makes you powerful than the problem. So you are able to control the problem. And there are other scriptures in the Bible. So most of the time when we are doing cognitive therapy, and cognitive therapy is simply restructuring the negative thoughts in the person's mind to positive. If the person is a Christian, normally we try to use the powerful scriptures in the Bible to do the restructuring, and it helps. So if you have a good mental health, you should be able to cope with the stresses of life. 3, you should be able to work productively and fruitfully. And then finally, you should be able to make a contribution to your community. So if these 4 bullets, you are not able to meet these standards, it means that your mental health is not good. You have a vulnerable mental health, or you have a bad mental health. But that is how World Health Organization defines mental health. And we need to also remember that, and psychologists always say this, that your thinking, your emotion, and your behavior are coherent. So the Bible will put it for us Christians, the Bible will put it as you think, so you are. That's how the Bible puts it. So what you think is what you become. And that's why the mind is very, very powerful. I have a friend in the secondary school who was always thinking that he will go to South Africa. And we even gave him the guy named South Africa. After school, we learned he had traveled to South Africa. And currently he's in UK. So the way you think, and that's why we always advise to think big. If we think big and it doesn't come to pass, nobody will do anything to you. But we should think big, because the way you think affects your emotions and affects your behavior. And that is what mental health also means. So, now I'll throw the question to us. And I will invite also those who are also online to answer this question. So, who is a healthy surveyor? Looking at the dimensions that I've brought into play, looking at what health is, and looking at what mental health or psychological health is. I would want somebody to help us. Who is a healthy surveyor? If you have any answer to give, please, you can let us know. Who is a healthy surveyor? Yeah.
A healthy surveyor is the surveyor who is physically, mentally, socially, and spiritually sound. That's my submission.
That is your submission. Okay. Any other person who has a contrary view? Please, what's your name? Mr. Boatin. So Mr. Boatin is adding all the 4 dimensions to explain who a healthy surveyor is. Any contrary view, please? So if you are a healthy surveyor, physically, you should be fine. Psychologically, you should be fine. And then spiritually, you should be fine. So these are the 3 areas. Remember, psychologically or mentally, we have broken them down into 3 dimensions. If you remember, psychological, emotional, and social. Because your relationship with somebody, if you have a bad relationship with someone, sometimes immediately you see the person, you have anxieties, butterfly. So that is social relationship. And that's what we call social well-being. Okay. Any contrary view about what Mr. Boatin said? If you have any other view that you want to. So please, do you all understand what a healthy surveyor is? So now when you are talking about health, don't only talk about physical health, but you have to talk about health in the other dimensions also. That is one foundation I would like to leave here today. So health is in different dimensions: physical, psychological, emotional, social, and then spiritual. Okay. I hope I can move on. Oh, they are, okay. Yep.
Surveyors who are atheists. The issue of spirituality.
Yeah.
Does it come in?
Yes.
Those surveyors who are atheists.
Yeah.
They don't believe in the existence of any supreme being.
Yeah.
Everything is by science and things like that. Can you add the issue of spirituality or spiritual when we are defining a healthy surveyor?
Yeah.
Thank
you. Thank you very much, Doc. So what I know is that if an atheist does not believe in God, he believes in something. He believes in science. But what I'm talking about is science. What I'm talking about right now is science. When we were growing up, we were thinking that when you talk about science, it means that those who go to the lab and manufacture whatever. But when I went to Legon, then I realized that any profession that goes through the scientific process is science. Okay? And when we talk about the scientific process, it simply means that identifying a problem and then making sure that you run an experiment or you do a research about it, and then coming out with solutions. That is science. So if an atheist does not believe in God, definitely he believes in something. And that something can be used to give intervention for the atheists to also get better. So please, have we laid that foundation? One of the strong things that I want to leave here is where the meaning of health is in 4 parts, and we need to remember. Okay. Now, is the job of a surveyor, is it a rewarding role? The job of a surveyor, is it a rewarding role? Very rewarding. Okay. So Mr. Botti says it's very rewarding. But it's also very cumbersome. Okay. So generally, the life or the work of a surveyor, stress is the largest health problem in the life of a surveyor. Stress. And the stress is into various components. Despite the fact that it's a rewarding role, I have friends who are working with Bank of Ghana, but they even look for money more than me. What I'm trying to say is that despite the fact that it's rewarding, we are still looking for more. And that is where it becomes very stressful and challenging. The stress comes in various components. The stress can come in terms of you yourself experiencing the stresses. You yourself. Sometimes internal and external. Internal means that you battling with something that you don't want the other person around you to know. You have been thinking about, it's bothering you. You can't tell anybody. Most of the suicidal patients that we get, most of them, and before somebody will commit suicide, the person should have attempted suicide 7 to 10 times. Because it's not easy to kill yourself. So the person attempts it so many times before committing. So it's a continuum. And then men commit suicide than women. But women attempt. I wish my mother was listening to it. Women attempt suicide than men. Yes. The man will commit. The woman will attempt. So if the woman is attempting, the woman is trying to draw your mind on something. So before a woman will say that it is over, then it means that it has gone. One case that I had, a lady whose husband was not paying attention to him, had a sexual intimacy with someone, and then realized that what she has done is wrong. So came back to the husband and said, husband, I'm begging you, I've done something wrong. I know you love me. This is what I've done. So forgive me. Not knowing that the husband picked this and went to file for divorce at the courts. And this lady said that, oh, I know I'm your wife and I've done the wrong thing. So, and I know we are husband and wife, so I wanted to open up to you. And you took this stance. If that is the case, then I will commit suicide. So the lady, the last suicide attempt that the lady did, she went to the Labadi beach, gave her purse and phones to some fisher folks at the beachside, and then moved away. She told the people that I'm coming. She went away, went to stand at the beachside and prayed, and then dived into the sea. So these people said the lady has died, so they also rushed there, also dived into the sea and brought her back. So when the issue went to the court, and the issue became that then the lady requested that the court grants her the opportunity for the children to visit, because the children were left with the man, the children to visit her every 2 weeks. The court had to refer the lady to me, that I should assess the lady and see whether she is capable of accepting the children every 2 weeks. Because anything can happen. If the children come and the lady says that, oh, then today I'm going to die with the children, that is something else. And the lady said currently she's there, she's working in one of the hospitals, and the marriage is dissolved. She's working one of them, and she's fine. Okay, so this is a serious stressor that triggered suicidal thoughts and suicidal behavior in this particularly. And we go through a lot of stresses. Okay, so some are financial issues, some are how to balance our work life and then family life. Very, very important. Work-life balance. Okay? I know some people take work home. When you get to the house too, either your husband, your wife, also that you are not paid, the children will come, the stress at home, so you are not even able to do it. And that you can't sleep well. Family problems. All these are stresses that we are battling with. The demands of your task that are given to you, that you need to meet deadlines. Technological changes, all these are stresses that we as surveyors, we grapple with. Role demands, interpersonal relationships, whether at home or at work and all. A lot of these issues will affect our performance as surveyors. And there has been a lot of research that has shown the relationship between stresses that we go through and psychological conditions. So one of the research that I read one in Europe, I read one in Ghana. So there were, and then President, what is happening nowadays is that generally we are looking at stresses in the general population, which is there. Now what is happening is that we want to look at stresses for only nurses, which has been done. Stresses, currently I'm doing stresses for footballers. That's what I'm doing in my thesis. For only footballers, professional players. So I would want to indulge management. I would want to do a research with surveyors. There will no specific what exactly is causing their stresses. Then we can know how to address them. But the general one doesn't really give you the picture. The general one is like, is for everybody, both nurses, doctors, surveyors. So you cannot get the true picture. Even when it comes to surveyors, we have different compartments of surveyors, and we can do research for these groups. Then we know exactly what their stresses are, and they will be able to address those specific stresses. But the research that was carried out showed that surveyors in general that had stressful jobs, role demands, and all those things, those stresses were related to depression and anxiety. In fact, the commonest psychological conditions that the general population, or the one that we see at the OPD almost every time, is depression, anxiety, and stress. These three, the commonest. It's like when you look at medical conditions, one of the commonest currently, I don't know whether it's hypertension that is topping. I don't know. I have to look at the non-communicable diseases. Yes. There are some common, like malaria, common disease that are seen at the hospital. In psychological circles, depression and anxiety are the cases that we see in the general population. But this is why it's related to the stresses that surveyors go through. When you take psychological conditions, the statistics shows that women are at greater risk of psychological issues than men in general. And the ratio is 2:1. And I was surprised, I also saw it when I was doing my research for surveying. So female surveyors reported greater risk in depression and anxiety concerning the psychological conditions than males. So it means that this research also reflects the general population. And in fact, one of the reasons why women are at greater risk of psychological conditions than men is the hormonal changes that you go through. Yes. It's one of the main reasons why women are at greater risk of psychological conditions than men. So depression and anxiety. Now, when we talk about depression, normally when people hear of depression, they look at one side. We have two types of depression. We have the low side depression, where the person doesn't want to, the person is helpless and hopeless. Helpless means that he thinks that he can't do anything about the situation. Hopeless means that he has lost hope in life, and he has lost hope in himself. The person would want to hide in the room, doesn't want to come out. If the person comes to the office, the person wants to be there, doesn't want to see anybody. Okay? The person either loses appetite or gains appetite. It's two-way. So there are people that you meet who have put on weight, but they are experiencing depression. Okay? This one I heard, they were saying that, hey, I'm out for a so now almost psychological condition. It was being said on radio, talking about parliament. Yes. Okay. So, and then the person also thinks suicidal. That's why I brought that issue of suicide in. This is only one part of depression. There's the other side of depression which we don't think about. That part of depression, we call it bipolar depression. And bi means two. So the person has a high side and a low side. So high emotions, low emotions. So all of a sudden, you see if it is, excuse me, let me use the gentleman. This gentleman who is calm. All of a sudden, you see this gentleman coming to stand here, removing the water, drinking it, starts talking about a lot of things. Okay? So it's like his emotions has been heightened. He starts pulling the tables and chairs and all those things. He thinks what he's doing is right. That is one side of depression. And then, once a while, it calms down. So for bipolar depression, the emotions becomes heightened and calms down. But for major depression, the first one, it is always down. When people see the bipolar depression, that's where they term as the person is mad. The person is not mad. The person is experiencing bipolar depression. Okay. Then the other part, anxiety. We have about 6 to 7 types of anxiety. I'll mention some few. One of them is called specific anxiety. Specific. So I went to speak somewhere, and then one lady said that if you have a daughter and she wants to read medicine, and she's afraid of blood, it means that she can't read the medicine. I said, no. We do intervention. That is specific anxiety. The person has anxiety is an irrational fear. So we do intervention for that anxiety to subside, and the person will read the program that she wants to read. Okay? That is specific anxiety. Some of us have anxiety for heights. Okay? Because of that, some of us haven't traveled through the air, especially when these aircraft accidents and things were happening. Okay? Other people have anxiety for marriage. And we do interventions for them to get on board. So that is specific anxiety. We have another type of anxiety that is called generalized anxiety. The person is always worried. You see the person always worried about, when you ask the person, what are you worried about? Say, me, I don't really know. So the person is worried about what? About nothing. That is generalized anxiety. Okay? We have another type of anxiety that we call panic disorder. The person would think that he has a panic attack, but it is a form of anxiety. The person will run all the tests, and the doctors will tell that your lab is fine, your ECG is fine, but the person is having something like a heart attack. It's called a panic disorder. Okay. Then the last one that I will mention is called PTSD, post-traumatic stress disorder. that one happens after a trauma. So after the person has experienced a traumatic event, and the person starts having a lot of symptoms. The person will be having a lot of intrusive thoughts, as if the traumatic event is happening now in his mind. He will not be able to sleep well, he can't eat well, and so on and so forth. So these are some of the symptoms that stresses can cause. And when you put all together, it will definitely affect the surveyor's performance. It will affect despite the fact that it is not physical, it is psychological, and it will affect the person's performance. So what are the basic interventions that we can use? Since your work is very stressful as a surveyor, you need to take some time breaks. And I don't know how it should be. Now in football, because I'm in sports psychology and I have a lot of experience in sports. Now when football is being played, the first half, they give a water break for the players to calm down before continuing. Yes. So we have to encourage our surveyors to take some breaks. It shouldn't be work. In between work, stand up, take some water, move about in the office, and come back to sit behind your PC and continue working. Now, awareness like this, CPD programs like this should also be organized. Okay. I remember one client that I had, this client, who on a particular weekend did a wedding invitation and gave it to her bosses and her friends at work that the following month she'll be having a wedding ceremony when nobody has proposed to her. So she gave the invitations out with date and everything. No names. Meanwhile, she hadn't had any proposal from anybody. So when the mother realized this, the mother brought her to my consultancy. And I realized that the lady was having a condition that we call delusional disorder. Delusional disorder means that sometimes you hear voices, a voice or voices speaking to you. If you have an aged father or mother, especially our mothers, if you have an aged mother, you see her displaying, there are signs of a lot of conditions. It can be Alzheimer. You have heard of Alzheimer. Yeah, it can be a symptom of Alzheimer. But delusional disorder, you hear a voice speaking to you, and they believe it is true. My mother, when I went there last week, she said that somebody has come to prepare fire, fire, the traditional one, in her room. I said, can you see any fire here? He said, the person brought the fire there. My mother is 87 years old. And you know, some of these delusional disorder happen, and later they become Alzheimer because the brain cells, you know, we need to exercise our brain. Yes. The brain cells are not being kept active. And if your brain cells are not kept active, the cells will die. So there wouldn't be communication. Some of these things will happen. And that's why we need to exercise our brain. Apart from the physical, we need to also exercise our brain. So for my mom, when she starts saying, that's why I said, some people came to her room, they were in white. No, before you go to her room, you need to pass through the hall before you get to her room. And all these are delusional disorders. So when this lady came, I realized that she has a delusional disorder. And one thing that we do for people who have delusional disorder is, apart from medication, we give them insights, or we make them aware of the condition that they find themselves. So I remember on the first day, I had to do a health awareness, whatever, for this lady. And that was the end. It took off the delusions. And currently, the lady has completed her MPhil at the University of Ghana. And I believe any month from now, she will marry officially. You know, the first one is official. Yes. Yes, so some of these training programs, CPD programs, go a long way to take some conditions of people's lives, and I believe it's a very good thing. Then we need to set up an open door policy so that anybody going through any condition can have somebody to talk to. When patients come to me and they talk, I listen to them. At the end of the first session, when I haven't done any intervention, psychological intervention, they say, hey, so just listening to people takes some burden off their head. And that's why the open door policy is very, very good. We need to make this anything that you are going through, at least you'll be able to voice it out, and somebody will listen to you. Then appointing a mental health professional at an institution. That's what we are championing now. That every institution should have a mental health or a psychologist, a clinical psychologist, so that if anybody has an issue, you just go to the office of the person. If the person is even coming there once or twice a week, you can just pop in. And then you also talk to the person so that you can have a healthy health. So the first one, I laid the foundation for what health is. And this second one, I have tried to look at the relationship between stresses or psychological conditions and then the work of a surveyor. And finally, I gave some basic intervention that we can use to make the surveyor who is going through any psychological challenge to be better, so that performance will also increase. So thank you for listening to me. I'm grateful. Thank you.
Oh, please, a better round of applause for our speaker. Although I'm not seeing you online, I can feel that you are clapping for our presenter. Interesting. Very, very, very interesting. I love one of the words that was mentioned. Psychosocial. I love the word. President, this one here, I believe you have also gotten interest in that word. Yes. Great. Dr. Yawson, we are so grateful to you for what you've taken us through. Those online, please, I'm waiting for questions. If anybody wants to speak, you can raise your hands. I'll call you. You unmute and then you ask your question. But let me ask this first question. You spoke about we exercising our brains. How do we do that? How do we exercise our brains? I want you to respond to that. So please, I'm waiting for questions. Those online, put it in the chat box.
Thank you very much. So physical exercises are very good. Okay. Physical exercises also affect so a lot of research showing that when you exercise physically, it also affects you mentally or psychologically. That is one. But specifically, you need to exercise your brain. One of the things that you can do is to read hard books. Books that are difficult to understand. Because it's difficult to understand, you crack your brain to understand, and that is the exercise. Another thing is our cultural games that we do, the Owaris, the drafts, the one that will make your brain cells work. That is the exercise that we are talking about. So despite the fact that the general exercise will help the whole body, specifically for your brain, you need to do brain exercises so that the cells will be activated. I hope I've explained myself.
Yeah, I'm clear.
Okay.
Sometimes overthinking too.
Okay.
I believe the mind has the level to what it can absorb.
Okay.
All right. So because sometimes even in school, if you've seen that experience, you see somebody learning,
Yeah.
then all of a sudden the person stands up and starts running around.
Okay.
I'm sure the person might have learned too much.
Yes.
So on that note, how do you manage it?
So
you don't overthink.
yeah. So overthinking has a negative consequence. Overthinking has a negative consequence. But this one, exercising your brain, has a positive consequence. Okay? So that is the difference between the two. Now we need to know, please, this one, I want all of us to listen. We need to know ourselves personally, the way your body functions, so that when something is going beyond a particular level, you know, you apply some intervention yourself. So for example, I realize that when my cholesterol is going up, I feel a little pain in the chest. So immediately, like this morning, I take beetroots and it clears it. So you should know yourself. That's the first thing. Know yourself. Know your physical health, your psychological health. If it's going overboard, then you calm down so that it wouldn't get there. So I believe that people who overstudy, and I remember Legon, some of them would take coffee, sit overnight. In fact, some of them do not work. We have a way of studying. It's rather, and that's why it influences or it affects this year's WASI. We don't start from the scratch to study when we get to school. We wait when it's getting to exams. And that is where you see somebody sitting at a place, taking coffee, want to study overnight. And that one, it can trigger bipolar. You remember I mentioned bipolar? It can trigger a bipolar. One happened to a student at KNUST, and he was studying overnight, taking coffee. Please, sleeplessness triggers bipolar depression. And that's why you need to sleep well. So if you are not sleeping well because you have piled up notes and you want to put all of them in memory at a particular, it doesn't work like that. So we need to advise our brothers and sisters, those in SHS, those in the university. You start from day one, read something small, and then you go on with the lecturer. So when it's getting to exams, you read your summary and you go and write the exam. But you cannot pile up. And then when it's going to, you want to push all those information in, it doesn't work like that. And we have a way that our memory works. It doesn't work by force. Okay? The memory doesn't, you cannot push in information. It takes time. Once you put it there. And that's why you're able to remember some of your poem that you said at KG. My brother, I remember. The poems are KG. You remember? But you remember one of them. A lion, you remember? Yes. 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 And you know why you remember this one? Because gradually, every day, your teachers will let you say it, and it is pushed into the long-term memory every day. Every day. And that's why even up to now, you remember. But there are other things that you even studied at the university that you have forgotten, because you didn't rehearse it every time. So we need to really help our kids. In fact, people are speculating that, looking at what has happened this year, next year it might be worse. There was next year it might be worse. Yes. So why all of a sudden there's a drop? Yes. 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 Yes.
This year's exams,
it
doesn't follow the
normal trend. Yes.
Because if they are falling, you should see that it
should be gradual.
Coming down.
Yeah.
But now, boom.
Yeah.
So what accounted for that?
There are so many reasons that are being peddled. But one of the reasons is that because WAEC was strict in terms of invigilation, people are not able to cheat. So what has been seen is so a lot of speculations. But me, seriously,
If you have learned very well,
that is it.
and they are supervising you strictly,
That is it.
taken out of you.
That is
You just produce what you have learned.
Yeah. Yeah.
And I don't think for the 3 years they have learned,
Yeah.
did these straight 1 year.
Yeah.
bring
Yeah.
that up? No. Then
Yeah.
if they think that way, then it means the education system
Yeah.
as a whole
Yeah.
is a problem.
Yeah. Doc, you know what I've seen? What I've seen is that most of the students who went for this national maths and science, they are serious students. Those who go, they had their 8 A's, their straight. Yes, straight. They didn't prepare well. They didn't prepare well. Okay, thank you.
There is a hand up from Surveyor Mahmoud Mohammed.
Okay.
Can you please unmute and ask your question? Surveyor Mahmoud, please unmute and ask your question. Yeah, please.
But thank you for your presentation. At the moment, I was going to ask you, when you said that you should consider doing exercises and doing physical issues, I was going to ask whether you play the typical daily activity of a surveyor, because it involves walking, carrying machines, and all sorts of things. So, if you are going to add physical exercise to it, wouldn't it be better just to remind me of the saying too much of everything is bad? So I'm just asking. Well, I like the aspect of you saying we treat allergic books. That we should consider, but to another exercise, well, maybe
It's a life surveyor.
Okay, so
but I want to ask you, Surveyor, should it be should it consider his daily routine habits vis-a-vis the work that he does, which should be a priority in case he finds himself so much stress? Which one should he consider the most so he can bring his stress level down? Thank you.
okay. So the first part, if you can, the line was breaking, so.
Mm-hmm. Means surveyors, we work a lot.
Yeah.
We go up and down.
Yeah.
What we more than that we are doing?
Yeah.
Because already
Yeah.
we are involved in going up and down in our work.
Yeah.
So adding that one to more exercises that we are talking about, what is it about? Can we still maintain what we do as on our normal work, or we still have to add more exercises?
Okay. So personally, I would want an exercise. Personally, when you see an exercise specialist, he might say something else. But I'm talking about personally. Personally, I would want to do an exercise that will make my heart beat. Personally. The reason being that whilst my heart beats, the pumping of the blood becomes stronger. And the blood is able to be pumped to all the parts of the body. That's personal. So I do a lot of work a lot. But personally, intentionally, on some days, like this morning, I have a stair that's a 20 stair that I go on up and down, and I do 10 every morning. And in fact, sometimes by the 5th one, I see that my heart is really beating, so I have to stand for some time, calm down, and do the second 5. So that's why I'm saying that the walking is good. But personally, I would want an exercise that will make my heart beat, to pump blood to all the parts of the body. Because if your heart also doesn't beat like it should, then it means that some people do a lot of brisk walking. That also makes their heart to beat, and it's okay. So look at the exercise that is good for you. That will make your heart beat, and I think it will be perfect for you. Then please, the second part, if you can repeat the second part. I think I was talking about work and health. Which one should be looked at first also? If Mahmoud is there, he can repeat that for us.
Mahmoud, can you please clarify the second question? Mahmoud.
Yes.
Yeah, can you clarify the second question?
Yes. So more or less to balance self-care vis-a-vis your daily routine. Yes. How would you advise a surveyor to be able to balance these?
Okay.
when he finds himself physically stressed, you know.
Okay. So I know in some organizations there is a policy that if you are not healthy, and now when I talk about healthy, now you all know what I'm talking about. When you are not healthy, you have the permission to visit a hospital, and then if you are given some days off, you bring it to your organization so that they will know that you are beginning some days off to rest. If you are not healthy, you can't work. So I think all of us will agree that your health is more paramount. Both of them are paramount. But when you are not healthy, you cannot work. So I think when you are not healthy, go through the normal procedure, the ethics or the ethics of your profession, whatever you have to do to visit the hospital. And then when you are healthy, you bounce back to work. So that is what I think, Mahmoud.
Thank you very much, Dr. Yawson. I want to say this, that members, those online, those who have registered, we will need your actual details for the design of your CPD certificates. Most of you have only indicated your first name. Some are using initials. Please give us your full name to be able to help us design your certificate. And then, most importantly, your full name and class will be useful. But at least your name that you want. If you're able to get the class, I think it will also be helpful. Now, there's a comment here. It says, participating in activities that make you brainstorm or solve problems. That is games like chess, dummy. These are good games if you involve yourself. Yeah. And also memorizing quotes. Yeah. This is what somebody has advised. Coming from Surveyor Ibrahim Rashid. Sure. Thank you very much for that advice. We're taking that in good faith. Any more, please? One secretary, you have a question for us? Very important. Yes, Sorry, President, please.
Yes, let me thank you. I would like to, we are probably ending. I would like to thank Dr. Yawson and say that the Governing Council, we're thinking of establishing for a start what we call chaplaincy units. That probably will involve some of you, so that periodically, because our members understand our profession. So if you're able to pick, say, 3-member professionals who have those skills, periodically we want to invite you to have that interface with us. And I will have to discuss with the AGM planning committee so that next year at our AGM, we probably will try and be a feature for you to have that bigger interaction with us. We probably are going, we don't know the little things that we are doing, the impact it is having on our health, our mental health, emotional, psychological, and spiritual. We don't know. So if some of these things are made known, I think it will go a long way. So we will certainly have a date with you at this year's AGM group. I will talk to the panel to craft so that at least we can have, it should be a continuous engagement so that some of these things will be taken up seriously. A lot of our members, they will probably will not open up. They have issues. They have issues. You've done your work, people are not paying you, you are chasing them, you are expecting a job is not coming, you are going to do your job in the field, you are being chased out. There's so many variants. You are writing proposals under pressure, you are pushing, and it's very married. So I believe when we call upon you next time, you'll be able to navigate us through the way so that we can practice as healthy professionals and not people who probably will be sitting on our own hours for us to see one day, boom, you are gone. I think we want to do that. So when it gets to that level, probably your expertise will be sought so that you can navigate and advise us very well. Thank you.
I want to say something small. Is it when we experience physical conditions, at least we are able to deal with it. So, for example, if you're having an headache, you are either you yourself you go and buy a painkiller or something. So that's why you're able to deal with it. But psychological health, especially if you experience trauma, I know people who have experienced traumas for life. So, for example, when there was this twin disaster at Circle, remember 2015, when there was this fire flood disaster at Circle, do you know the survivors? They are still battling with the trauma up to now. The survivors. So when we talk about psychological issues, it's even more. We call it the silent killer. And when Doc said you are working and all of a sudden you just dim, and I remember this. So we should be more intentional about dealing with psychological issues at the same time the physical issues. Thank you very much.
Thank you very much, Dr. Yawson. We have 2 questions in the chat box. The first one coming from our own Robert Hackman. He says, what strategies can we use to manage stress and prevent burnout in a high-pressure profession like surveying? And the second one coming from Joseph Saki, Surveyor Joseph Saki. He says, someone is into drugs. Though normal, how can you help him stop?
Okay.
There are 2 questions.
Though
normal, how can you help him stop? Surveyor Joseph Saki, this is your question.
Yes.
Right, please.
So normally when I'm answering the second question first, normally when somebody is into drugs, depending on the addiction level, what we choose to do is to refer the person to a rehab. That one, the rehab center takes care of everything. And we have had some Ghanaian VIPs who have gone through a lot of drug-related issues, and when they went on rehab, they are better. Some musicians and then some actors, and they are better now. So if it is not addiction, we can be able to do. We can do detoxification for you using medications to be better. But when it becomes addiction, and that's why we don't worry ourselves, we just refer you to a rehab. And we have a lot of rehabs in Ghana, even in Accra. Okay. Then the first question, please can you repeat the first question for me?
The first question, what strategies can we use to manage stress and prevent burnout in a high-pressure profession like surveying?
Yes. So I mentioned some. I can't mention all. I mentioned some of the strategies. I said, 1, take some break for yourself. I remember I mentioned that. Yes. Take some cool-ups for yourself. So don't work. Get, even within the work, get some breaks for yourself. Another thing that you can also do is to break down your voluminous work into smaller bits. So you do one thing at a time, okay? But the whole thing is that when you realize that when you are doing all these little interventions and it's not working, that is where you see a clinical psychologist to help you deal with the issue itself. Okay. So please, is that okay?
Yeah, I think for now,
okay.
I believe the slides will
exactly,
give it to us.
Exactly.
I think some of the answers are
they are in the slides.
slides.
Yes, please.
Okay. Now, there is another question.
Okay.
Another question coming from Barnabas, Surveyor Barnabas Derry. He says, I was attacked by some robbers some years back, and I'm hunted ever since. Whenever I walk alone and I hear footsteps, no, sorry, let me repeat again. I was attacked by some robbers some years back, and I am hunted ever since. Whenever I walk alone and I hear footsteps behind me, I get panic attacks.
So this one, it has become a psychological disorder. That's what I was talking about. So this person would need psychological intervention. We would have to do an assessment. In fact, I'm not seeing it as panic attacks. I'm seeing it, and I mentioned it, I'm seeing it as a post-traumatic stress disorder. So we have to do an assessment and then diagnose well so that we're able to give that person an intervention. In fact, we have people who have been raped in infancy, and because they were not treated, even in their marital life, they are experiencing the symptoms of abuse. So these are, and we get cases like that. So despite the fact it has been long, he is still experiencing the symptoms of post-traumatic stress disorder. So he has to be seen. Was there another question? Okay.
Yeah, I remember in your presentation, you mentioned, you said something about clinical psychologists being different from
Counseling psychologists, yes.
Can you please
elaborate
on it?
Yes. Counseling psychologists don't do assessment, diagnosis, and treatment. So, when you come to me, whilst you are sitting in front of me, and you start your narration, or I ask you what brought you to me, and you start your narration, my mind starts going to the categorizations, like, is it this, is it that, is it that? And then the symptoms that you are telling me, I'm putting them in the various categorizations. So for example, you come to me and said, oh, maybe today, like this lady who was beaten by the husband, comes to me and said, because of that, I'm not able to sleep well, I'm not able to eat well. Now, when I see any man, I'm running and all those things. So my mind starts going to conditions that have symptoms like that. Are you okay with that? There may be 2 or 3 conditions, but my mind goes to conditions that have symptoms like that. Then, so let me, I just oppose it to medical doctor. So medical doctor will ask you questions. What brought you to me? My head, my shoulder, this. Okay. Then go and do a lab. When you come to me to, apart from the assessment, I will say that I'm going to administer a psychological test to you. The test and the assessment will tell me that, oh, this is what you are experiencing. And for every condition, there are treatments that we do. But counselors don't do that. And that is the difference. And clinical psychologists also work in hospitals, mostly. But counselors don't work mostly in hospitals. There are other places that they find themselves. Counselors also refer to clinical psychologists. Yes, because their competence, if they get an issue that is beyond their competence, that the issue becomes clinical in nature, they would have to refer. So that is the basic differences between them. I've done that for the psychiatrist already, remember? Yes. Okay. So there are thin lines between the 3 of us. Yes, please. Thank you very much.
Please, another round of applause for our presenter. He's done so well, and I want to add up to what President said. He made a proposal on the stresses for surveyors, and I think GhIS will be much interested in that. Very, very interested. And then, in line with the exactly. And also in line with the open door policy. Very, 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 very good for us as an institution. And then the appointing of a mental health professional. So, indirectly, somebody will say, our doctor is campaigning for himself. So we want to thank everybody who took part in this CPD. We want our doctor to share his final words with us. Then we run up the program for the day. Thank you, doctor.
So wherever I stand, I tell people that psychological issues are real. They are real. In fact, when you look at the non-communicable diseases worldwide, you realize that depression, anxiety, and so on and so forth are parts of the first 10 for non-communicable diseases, psychological conditions. So please, if you are not healthy, you cannot work. So we should take our health seriously And then when you realize, and I remember mentioning that you should know yourself. Know yourself. If you're healthy, you know you are healthy. If you are not healthy, immediately something small happens to you and you realize that you are not healthy, immediately seek help. Either you see introducing the word that my friend likes, by psychosocial. Either you see a medical doctor, see a psychologist. We refer to each other. Please don't spiritualize physical and psychological issues. You'll be praying alongside as you do the others. And I believe that you'll be healthy to bring about improved performance. Thank you very much.
Thank you very much, Dr. Yawson. But I believe we have some of our members who shy. They feel shy to speak. Some don't want to talk, but they have the problem with them. Will you mind if we share your email, your contact on the line for people to know? That's fine. So members will be sharing his contacts on the line for you to contact him anytime at all. On the platforms, we'll put on a platform for you to contact him. So time so soon, we've come to the end of this session. It's been a very, very fruitful session. And we are so grateful unto Doctor for your time. You know, this program should have happened last week, but due to some 1 or 2 challenges, we had to push it to this week. Yes. And you know, sometimes people don't take some of the talks or some of the programs very serious, because this is a very, very important topic that we're expecting more people to be online. Although the number is not so encouraging, is good for us. It's very, very good, because if you are serious about something, you will go online and attend to it. So we'll be having more of such sessions with other professionals who will be coming on board. So once again, we want to give a big clap onto our brother and our senior colleague in the profession. And we are hopeful that the next time we invite you, you will surely come to us. So President, or my Honor Secretary, you know, when it comes to vote of thanks, ladies are good at that. So please come and do that for us, on behalf of the institution.
When I said ladies attempt,
so you have our Honor Secretary giving us the vote of thanks.
Thank you, Vice. So on behalf of the President, the Governing Council, and all members of the institution, we say thank you for the knowledge you have shared with us. We will put it to good use so that it will help us become better in our practice. Thank you so much.
Thank you very much, Honor Secretary. Not knowing people were, my colleagues were putting on the platform, please, his office location and contact. So, you know, just relax. Colleagues, just relax. We'll put the contact there. You call him. Because where he's located, he alone can tell you where it's located. I cannot tell you where it's located. So please, we'll put the contact on the line, and then the presentation too will be put on the platforms for you to go to. Okay, it will be on the website. Please, we are using this opportunity to revive our website. Go on the website, and then you find his picture, where he's working, and then his contact. Everything, and the presentation too, we'll put it on the website. Please visit our website, and then you get everything about it. Shall we have our brother Boatin give you the closing prayer?
Let's pray. Almighty God, we thank you for this successful session. We thank you for the life of all participants and the organizers. We continue to be at your feet and ask for better things ahead. Grant us surveyors excessive grace, good wisdom, and good health, so that in you always say that you've taken good care of us. So we lead unto you our physical, our mental, our social, our spiritual life. God, protect us and guide us all. Amen.
Thank you all, and God bless all of us.